Okay. It being 2:03 on March 8th, 2023, I'm going to officially call the meeting of the Greater Boroughs Partnership for Health Advisory Board to order. Just for some housekeeping, Northborough likes me to read a really long script to all of you, so bear with me here. So this meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely pursuant to Chapter 22 of the Acts of 22, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on July 16th, 2022. All members of the advisory board are allowed and encouraged to participate remotely. The act allows the advisory board to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using a posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So we're just going to do a roll call vote. So members, when I call your name, please respond in the affirmative, and we'll call both primary and secondary voting members, just because we have so many people here. So I'll start off with Sarah Barrett.
Sarah Barrett, Board of Health, Boylston, here.
You. Heather Alker.
Heather Alker, Southborough, here.
Jennifer Sullivan. Oh, you're muted, Jen.
Sorry, you think I'd learned by now. Jen Sullivan, Westboro, here.
Okay, awesome. And I don't yet see Chelsea, so I think that's every we have all our primary. Also, I'd just like to acknowledge that we have Anne-Marie on with Boylston, as well as Isabella Caruso, our regional epidemiologist, Michael Seeger, our shared health agent, and Erin Coulard, one of our shared public health nurses. I also see that Jim Frederick is joining us as well, who is, again, a Greater Boroughs Partnership for Health public nurse. And I think that's I think we got everybody. So thank you, everybody. It's great to see all of you for one of these quarterly meetings here. Some really exciting updates as we're moving along with our shared service grant. So I just want to draw attention to the agenda. We'll start off by briefly discussing the Public Health Excellence Grant for Shared Services. So just a couple of housekeeping items. I'm going to hand over to Isabella if you want to take those first few items there.
Perfect. Hello, everyone. So I believe all 4 towns have received their MSA contract. Is that correct? I know Kristen and Heather has signed it. Jen, did you ever receive? You're on mute.
Today's not the day. I'm sorry. What did you say?
The MSA contract. I know we had gone back and forth to make sure that you had received that from the state.
I don't believe I have.
Okay. I will reach out to Sarah Trigger from the state. Sarah, you had signed it, right? You or Dennis? Okay, perfect. So that should be all set, Jen. I'll get Westboro figured out.
Yeah, no, I haven't received it yet.
Okay, perfect. I will touch base with them. As for other updates for the Public Health Excellence Grant, I am going to share my screen quickly. So this is a new initiative. Sorry, my screen's loading. A new initiative through the state, their health racial equity training. So it is required for all PHE grants. So basically all directors will need to attend, as well as any shared staff. It's also recommended that any health staff, one board member from your health representative, as well as any staff in the health department. So it's a 3-hour Zoom training. You can I've circulated this flyer before, but I can send it again. You just need to click the link and sign up for a training. They are throughout the month of March at multiple different times for people to join. Does anyone have any questions about this training? Perfect. So yesterday Monday, we had the DPH capacity assessment discussion, and I just wanted to share the screen for the recommendations they gave us and really open the floor for any conversation. They basically kind of just gave an overview of their data collection and data methods, and now we have the opportunity to discuss their recommendations and to see what we want really to bring back to them. So I'll open it up to any feedback on this cart.
And I just want to state, I believe you all should have received the cart. I emailed it out to everybody on Friday. It's a lot to digest. You know, I think about half of us, at least on this call, were part of that meeting with BME with the state, who's the consultant they've hired. And so again, this is only page 19 of this large cart. I think, you know, it's definitely worth a read through. Isabella's here to facilitate, I think, for all of us. If we don't understand the results, which I have questions on some sections, you know, being able to go back to the state and say, like, could you explain this or why? I think the biggest discovery for me in that, well, one, I don't know if I 100% agree with their recommendations regarding where we need to focus our efforts. I just want to highlight number one is that they're highlighting that disease control and prevention is somewhere where we need to possibly invest. And I think we do have a robust public health nursing staff and epidemiologists, and the data that they pulled as part of this report, as a reminder, was really from a period before our shared staffing came on. So it looks like that's where we need our greatest amount of effort, but I think we've already. So I just want people, as we're thinking about recommendations and where we go, you know, really keep in mind, like, what was the data set, where were they looking at that time? And so I have some concerns. I think there's the level of what we're looking at in recommendations is where do we need to increase staffing? Where do we need to increase supplies? And where do we need to increase training? And I think part of it is the state sort of gave us, hey, upload all these documents, but they didn't really just ask us, so like, just because they asked for one random document, you may have scored low or we didn't have it uploaded. It doesn't necessarily mean that's where we need to invest. So I think it's really important we understand what the needs are of all our 4 communities as we go into these next, rounds of planning. And so, anyway, just wanted to preface that, as you guys are starting to digest this in our next steps.
I would like to say the Maven response capacity was shocking to me when we first was told about it. So I don't believe we need increased staffing for that.
I agree. And same thing when I saw the data's 2019 and 2021 on the Maven response and the disease control and prevention, and the staffing has just wildly changed since then. And putting into place the public health excellence nurses, I don't think was even till the second half of 21. So a lot of this is not pertinent, I would say, at the moment.
And also the Tobacco Control Coalition, I believe we're all on the same page right now. So unless they come back and say that they're not expanding their budget, I don't think that needs to be examined any further either.
Right. We need to be in tobacco control coalitions.
Kristen, just so you know, Chelsea just got here. She's sitting with me. Hi, everyone. Sorry I was late.
Chelsea. I want to touch a little bit more on tobacco control. So Northborough and Boylston should consider joining group, right? But even more so the fact that Southborough belongs to one region and Westborough belongs to another, especially it's not in geographically central. Like, my goal would be all belong to the same. So we worked hard, and thank you to everybody who has been sending information over to Bill Murphy and his team in Framingham, because they're the lead for Metro West. And we've all been working independently with staff to try to get all that information to Framingham so we can all be part of that region. There's been a few emails back and forth with the state regarding the RFR that went out, and that there's a preface that any town that doesn't belong to a region cannot join an existing region. They would need to make their own region, which I find outrageous that we would be such a small shared services region of 4 and we couldn't all belong to one because of some of these requirements. So we're working through that. I don't think we have an answer. My understanding is Framingham is submitting for all 4 communities to belong. But what I'm hearing, the RFR is closed, so we really can't get, or the question and answer period's closed. We can't get a straight answer, but the idea that Boylston and Northborough would go form their own collaborative on their own for our 14 establishments in Northborough plus 4 or so. And Boylston would be 18. And they're saying it takes about 300 tobacco establishments to have one full-time inspector under that grant. So, I mean, when you only have 18 for the 2 outstanding towns, it doesn't make a whole lot of sense to create a region and to be putting all that time. And at that point, you just contract it out. So I don't know if there's really anything more we can do within this window. So I think regarding tobacco control, we've all done what we can. We're trying to be part of that region. And we're really at the mercy of the state and the RFR and that whole process as to whether or not that's come together. I think we've made the request to be part of a shared region. Isabella and I are meeting with Cassandra, our, DPH PHE rep, and she's been copied on all of this. And so they understand we're trying to do it, but at this point, it's really, it's on the state and how they're going to award those regions. So I think it's out of our control at this point. If we aren't joined up, or they're not going to allow us to all be part of a single region, hopefully Metro West, then we'll have to look at alternatives, which could be for fiscal year 24, contracting that work out and paying for it from our PHE grant or possibly the contact tracing grant or another grant. So I think there's solutions, number one goal, and I think we've all done the homework. So thank you. But yeah, hopefully number 2 will be addressed. And if we can't all
no,
join
I
the region,
agree.
we'll-
But was there anything ever from the RFR or thought about trying to get into the same tobacco region as you are with your public health excellence group, or that's not specifically laid out?
I can't answer that. I haven't read the full RFR. I don't think it spoke about PHE
Okay.
regions in particular. I
But
think
that would make sense. Okay.
yeah, I think what the state was saying is that existing regions, it's not on the same cycle as creating new regions. And so it didn't seem like it was either add more or become a new one. It seemed like right now the RFR may be only open for individuals forming new regions, but I don't think it makes sense for such a small group and 18 establishments to go and try to form their own region. You would just contract that limited amount of work. Michael can, attest, he went out with one of the contracted tobacco compliance officers that's contracted through, it's MHOA, I believe, or is it MHB, Michael? And that was just a day event to knock out all 14 of Northborough's establishments. So we're not talking about a ton of work to address number 2,
What about the community sanitation? Because I think we all agreed that the disease control and prevention is being met at the moment.
And I wonder if we could request the raw data from BME. I'd be curious to see how our region did on maybe not identifying by town, but on nuisances in particular. Like the community sanitation, I think was just lumped. There was a question that was asked during the presentation. When they say community sanitation, I believe they're dumping any requests or data uploads related to housing are into that category as well as nuisances. And so I would like to request more information from BME to see if we can drill down a bit. I don't know if there's any categories any of your towns are particularly interested in.
I think the housing software helps, right, in terms of the documentation for that, but for nuisances. But that's a small piece, but getting the documentation for that, it may be happening, but not the documentation.
And I think regarding number 3, their note that, ability for backup documentation. And I think, there's been a lot of staff transition in a few of our towns. And so that's a result of that. And I think we all have more stable staffing. So hopefully that's not an issue moving forward. And likely with our regional training hubs, we're going to start to see training around these topics. I'm hoping they'll be releasing information about best practices or maybe documenting various nuisances and, keeping records or tools that we could use to improve our capacity there. But well, we're just going to have to stay tuned. I'm not sure if we're going to get that kind of support from DPH through the hubs on that topic. Okay. So I don't know if we necessarily have action items. We're not going to dive in at this point into our budget per se for PHE.
When are we doing that? Yeah.
So the presentation earlier this week with BME, that was the first time they gave us a date of April, what was it, April 23rd? They gave us a deadline to submit a draft budget for our PHE region. And that date was sometime in April, but I don't even have the template to fill in to show all of you. So I do think we're going to have to hold a quick meeting next month just to vote the draft budget that I would be submitting to the state. So stay tuned. It would probably be only a half-hour meeting, but I think we're going to have to post that just from the timelines. I don't have a draft to complete. We'll have more information. And obviously the way we write our budget for our PHE grant is really depend about our budget for our contact tracing grant and our allowable expenses and how we complement the two. So there's certain things we can put on one grant and not on the other grant. And so I think until we gain a better understanding, and Isabella, we can note, we have a meeting coming up next week to talk to our contact tracing grant folks. Kevin Cranston and Hillary are the contacts on that grant. We'll hopefully gain more information, and then we can try to draft up a budget and have a meaningful discussion on that next month and still meet the state's deadline for submitting the draft. And I just want to keep everybody aware, I was going back through old meeting minutes that we'll be voting today. And I noted last year we were meeting in September to talk about the budget approval for the year we were already in. So we drafted and approved and didn't, with the state, we were like in the budget year. So they are finally getting ahead of it, which is great, makes a lot more sense. But we'll definitely catch up and meet those timelines. We just don't even have the templates or the information from the state yet to figure out how to write those two budgets. I don't anticipate any huge changes, but that's part of the process. So if any of your boards are interested or departments are saying, hey, this is a need, I don't think this is valuable, we'll get the draft to you in advance. But if you have ideas for spending, we can get to that. The one other thing, Isabella, could you share the slide from the BME presentation regarding supplies or equipment? I think that's worth looking at because we do have some equipment line items currently for purchases that we may be able to put it within our fiscal year 23 budget.
Correct.
Yeah. So this is regarding inspectional tools that are available, obviously for on camera and flashlights and thermometers. So I think maybe what we can do is a follow-up, Isabella, to our towns, that if there is a desire for a moisture meter, which can run anywhere from $100 to $200, that would be of value to your housing inspectors, or any other equipment. They're not really specific. I'm not sure what air monitoring equipment they would even be referring to.
I love the noise meter and the moisture meter.
Okay, so noise and moisture, you would like to place the order? Okay, I'm hoping we can get a recommended model from our subject matter experts, like a Paul Hoffman, like what moisture meter would hold up in court, or, versus us just picking an Amazon. So if you have a product in particular, let us know. Isabel will make notes that Westboro is requesting a noise meter and a moisture meter. We'll see if we can get products. I know for the noise meter, the NIOSH app that you can download on your phone can also be a tool to measure and record noise. But again, I don't know if that, I think we need to check.
DEP, I found, frowns on that. They actually like you getting the meter from them if you don't have one, and it's just a pain. So if we could have our own, that'd be great.
So that's where DEP would want you to go borrow their meter. So maybe one meter in our region would be adequate. That would be a shared resource.
Yeah.
If Westboro,
Well, I
you're the
think
largest
maybe-
town, you could hold it and then we could just borrow as needed.
Sure.
We'll have to see where the pricing comes
I was
out.
gonna say, yeah, let's see. I mean, if it's affordable for everyone to have it, that'd be an asset for everyone.
Yeah. Okay.
And I as well saw the minutes for September for the FY23 budget, but do we have a copy somewhere of the FY23 budget that we could look at?
Well, it hasn't changed since the one that was approved and discussed at that meeting. So we
Right,
could
but so
send
we
that.
have the hard copy of it that went out with that meeting?
Yes, that was submitted and hasn't changed, but we'll recirculate that.
Yeah, just to
so-
circulate that if we're
Yeah.
gonna look with our boards. Okay,
Yeah.
thank you.
Okay, any other thoughts on ordering of supplies or this slide here?
I want to check with Dennis and see what his thoughts are in terms of equipment, and because it's difficult to tell from this, like which town, if it's a 1 out of 4, well, which town was the one? So I want to just review this particular slide with Dennis, and then I'll get back to everybody if that's okay.
That's great. Well, you have
Okay.
time. And the good news is from an ordering perspective, it's only March, so I have plenty of time. This is a great time to be finding the product and ordering it so I can get it by year end. But we do have a pretty large budget between the 2 grants on supplies, and we can get clarity from the state for some of these allowances. But this is low hanging fruit. We can take care of supplies. Okay. Thanks, Isabella. Okay. So any other discussion regarding that capacity assessment?
No,
All right.
Do you want me to send you a list of like specific questions that I had, like finer details? Okay.
Yeah, I think if anyone has questions regarding that cart, that large document, and what what was the period of time and what was the measurement, I think we should request away.
Okay.
If it's valuable, and if they won't release it, that's okay too. But
Okay.
it will be interesting if we could drill. One question I would definitely ask is about being able to drill down into that, like nuisance complaints or things like that. Like,
Yeah.
are there any more detailed trends into categories versus just the way they presented it, which was just a lump sum? So
Yeah.
yes,
Okay.
send those questions. We'll be meeting, and that was part of the presentation from BME that there is some back and forth there. Or if there's anything we believe needs to be clarified or changed in that report, that maybe a town reported the wrong number and things don't look right, we could also look to make corrections. But
Yeah.
okay. So I would just say we'll try to submit that by the end of next week. So if you have ordering requests or wanting to request additional information from BME on the cart product that we just viewed, if you could get those by the end of next week, that would be great. So I would say the end of next week by March 17th. No, yeah, March 17th, it's flying. Okay. All right. If there's no further discussion, we'll move on to our second agenda item, our local health support for COVID-19 case investigation and contact tracing grant, which we just call the contact tracing grant. The great news you received by email. We found out, I think it was like January 30th, we received an email from Kevin Cranston. So surprise, surprise. It was supposed to be a 2-year award of $160,000 for contact tracing support for our region. And guess what? We're going to give you a 3rd year. So we had already done a lot of rearranging and plans to carry over funding to keep our contact tracing grant on. And so now we have a lot more money, which is great. My initial thought from a budget planning perspective is that we would just keep rolling, and can we get 1 more year out of it? And, so it was originally a 2-year grant. We're in the 2nd year ending June 30th. We were told that any funds that we didn't expend through the 1st or 2nd year could be rolled into fiscal year 24. So going to not this June, to next June. So the question that the state has yet to answer is, would we be able to, given we're getting a 3rd year, could we roll any year funds from 1, 2, or 3 into year 4? And we don't know that yet. And I think that is it's hard to build a budget and to spend out all this money we weren't anticipating. We could look to bring in additional per diem or contracted staff, right? Because it's such a short window. We're not going to create a new full-time position and hire. The other alternatives are larger purchases, supplies, per diem nursing, for example, running additional clinics, falls prevention, education, outreach. Isabel, we did send a request to Hillary and Kevin, who are overseeing that grant. There were some ideas we had for use of the funds. And so those included, continuing to expand our Narcan distribution. We need purchasing of just the bags, just to hold the product, really small, some printed educational materials. We talked about trying to do more outreach, public health education, printing posters, even maybe working with a graphic designer to help us on an educational, public health educational sort of campaign and calendar over the year. And they were very open. Did they say no to anything, Isabella? They were like, sure, that sounds good. So the contact tracing grant is very flexible. We did ask about sunscreen dispensers through the PHE grant, and that was a hard no. They did say we paid for it in the past. So that's the only thing we have a hard no on. But there are ideas, maybe in the follow-up, Isabella, we could send those to people because we're still brainstorming this fiscal year 24 budget. And we will have to justify the use of all funds for next year. So even if they tell us we can roll the funds for one more year, if that works out, roll into fiscal year 25, we're still gonna have to justify the use of all funds in fiscal year 24. So ideas of, building up or contracting work or, health communication materials. The other idea we spoke about, and I'm curious if any of you have an interest, is one thing we've been doing in Northborough is we've really been doing a lot of CPR AD training. This was through Be Well Northborough, which is a separate ARPA funding source for our town. But we heard from the public, especially after the football player went down on the field and everybody's thinking AEDs and CPR. And so one thing that we've done in Northborough is we're working with a contracted nurse, not one of ours here, but another nurse that we contract with. She's coming into our library. And we're doing reduced pricing CPR and first aid classes, just CPR AED classes. And that has been very well received by the public. So we did ask DPH if we could train our existing nurses that we have here so we can make them trainers. And they could be trained either through American Heart Association or a different group. And then thereby they could train the public at a low or reduced cost program. So the state is open to that. And they'll even pay for us to purchase the dummies or the mannequins, for the CPR, the trainer AED unit. So I don't know if you can speak to that, but is that something other towns where you would be interested in offering CPR AED courses to the public, either through your libraries or rec programs or whatever other way you guys program?
I definitely would want that for Boylston.
Okay.
Yeah.
And
Yeah, I would.
we have a program for employees, but yes, the public.
Okay. And then what about Westboro, Jen? Are you interested at all with nurses offering CPR AED training to the public? I know the fire departments often do it for staff or schools, for example, but they don't, at least in Northborough, haven't had the bandwidth to do public classes.
Yeah, I'll have to get back to you on that, because if I do believe the fire department offers it regularly.
Mhm.
Let me just find out and I'll get back to you.
Okay. So that's one of the things we're considering that we'll obviously look to, formally vote or have further discussion on that, but it's not and again, it's at the interest level. Erin's been great. She's expressed some interest in that training or, to be, the trainer program. Jim, I don't know if you have any interest as this proceeds, but that's an option for nurses and staff.
I'm already certified as an instructor and stuff, so it's easy enough to come right on board. So
Okay.
what everybody can decide at the end, just let me know.
Are you through American Heart Association or which?
Yeah.
Group? Okay.
Yeah,
So that's what Northborough works through as well. It seems like that's the easier one to work with. So more to come on that. So Jen, we'll stay tuned and wait to see what you guys hear on your end. So I can send you some examples of what we're doing in Northborough with the libraries. We released 2 classes at $15 each for this past month, and they filled instantly. We just released today, or maybe it was yesterday, 6 additional classes, so 2 per month for the next 3 months, and they're like half filled within a day. So there's definitely the demand. The cost for us to bring in a third party, it would be lower if we used our own nurses. We pay a nurse $60, for example, per student. And the town subsidized through the Be Well funding $30 of that. So what we found is when you offer totally free programming for the public, everybody signs up and then they don't show, which doesn't work well when you're doing a capped class size. So what we probably want to do if we were to do this is to say it's reduced cost. So if Greater Boroughs can cover the cost of the mannequin, I don't know if they'd agree with the cost of the card, but we could do the free training. And then maybe the individuals registering would just pay the cost, of the card, which is typically $10 to $15. That way they have some skin in the game. It's a reduced cost. They can get trained in their own town. And then our trainers would do that work. So it's something to think about. We can definitely investigate that.
It would be sort of the AHA model sometimes where they do the kind of the online studying in advance and then they do the in-person.
Yeah, in Northborough, we've just done it 2
Right.
ways. We just trained 60 employees in town doing the blended model, which is about an hour and a half online with AHA. And then they do a half-hour hands-on session, which ended up really, it would have been better 45 to an hour. Whereas the nurse we're using for the public who's doing the same curriculum, which is the AHA, she's just doing a 2 to 3 hour in person. And we find that it's a lot easier than supporting all of our public with logging in and unique URL. Like, so I think the method would be to just do it in person, hands-on, because doing the hybrid, you have to, it's a lot of distribution of links and administrative, but I think we could look at both options. Okay. So we'll stay tuned on that and budget planning. So look for a meeting. We'll probably, Isabel, talk and get something on the books and have a placeholder for a budget approval next month, abbreviated meeting. So we can, unless there's any other questions on the contact tracing grant, we'll move on to our next agenda item. Okay. So next up is the Impact Melanoma and Sun Safety Program. Isabella?
Yes, so Northborough and Southborough have already kind of filled out or basically sent their logos. So those are in production. So those will be sent hopefully in the next like month or so. I know Jen, you are asking Metro West for funds, correct? Okay, perfect. And then Sarah, any update on funding on your end?
I don't have an update on funding, but I do have a more general update. I did attend another Parks and Rec meeting last night, and they have identified 3 parks in town where they're interested in the dispensers. None of those parks need poles. So I think what I'm going to do is, unfortunately, we had to cut our Board of Health meeting short last week. There was a medical emergency. And so I didn't get a chance to ask about funding from the board for some of this. Because I do think, you know, when we met, Erin and Isabella and Dennis and I met, and Dennis had said that the Boylston Board of Health had some money for this particular program. So knowing that they've identified 3 fields without poles. I don't have the numbers right in front of me, but I want to say it's a little over $2,000. I think is what it comes out to be. So, you know, I think what I'm going to do is either tomorrow or Friday, show my face in a couple smaller businesses and try and do, that's why I was asking how many corporate sponsors we could get onto the dispensers themselves, because if I can get 2,500 grants or, you know, 3 for lesser amounts and then have the Board of Health fill in a little bit, then I think we can easily cover the 3.
Perfect. Yeah, so Northborough, we have 3 logos and Southborough has 2. So I think 3 fits comfortably.
Okay. I do have one question for you. Anne Marie has graciously volunteered to set up a table Memorial Day, which is when Boylston comes together as a town, really the one time the whole year. So that's where you're going to get, you know, your most bang for your buck. And you had mentioned that Impact Melanoma might be willing to send out sunscreen samples and lip balms and anything else in pamphlets and brochures. Is that something that you can get by Memorial Day, or I could tap into Impact Melanoma? How does that work, and how can I get that delivered? I don't even mind if it comes to my house or the Board of Health office. You know, I just don't know the avenue to get there.
Yeah. I'll send an email to the manager and the assistant manager that I've been talking to. I'll CC you so we can communicate, and we'll get that to you for Memorial Day.
Perfect. And Anne Marie, Parks and Rec said that you could set up near them on the common so that, you know, we could kind of show that we're in collaboration with them and supporting this effort. So I think that's my update, but I am going to show my face in a couple smaller businesses, and maybe I can get a couple 500s and cover it that way, so.
Perfect. Do you need an updated proposal for 3 sunscreen dispensers?
That would be helpful.
Okay.
Yes, please. That would be helpful. But Parks and Rec is, they're very interested in, I don't know how invested they are monetarily, but they love the idea.
Okay.
But, you know, I think someone on their board is willing to talk to Boylston Youth Soccer, because I just don't have contact. My kids are, you know, in their 20s. So I'm way out of that. And so they were going to contact 2 of the youth, like one was soccer and one was basketball or baseball. I can't quite remember. Maybe they would want to share one and get their information onto a dispenser. And, you know, if like Philips Precision and Crest Technologies did, you know, each did 500, that could be another one. And then if the Board of Health could do the 3rd one, we're covered, so.
Perfect. And then Jen, did you have an update or need anything from me for that?
Nope, just waiting to hear back. She
Perfect.
said
All
it
right.
was going to get approved. I just
Okay.
want to get it in writing.
Perfect. And then we'll get that process going. So hopefully we'll all have dispensers for the summer.
Yeah, it's very exciting. Thank you.
Yeah, of course. So that is the update for that. And once I get, hopefully I get, you know, table sunscreen and brochures and things like that, chapsticks, we will get those out. Yeah, that is my update for Impact.
And just another thought on impact melanoma, if, you know, while the state was with our funding would not approve the purchase of the dispensers, I would likely that they would approve the purchase of any educational or health promotional materials. So if we feel like, Isabella, those aren't robust enough in terms of what we're getting, or to get some of the items that Sarah was requesting, I think we have that within our supply line item to get some promotional materials. So that's something we can look into as well, just to have those shared and regional. So, okay, if we're moving on, impact melanoma, our next agenda item is our substance use work. So I just want to mention that the state did host, many of you may receive one of these many emails to attend a webinar on the opioid settlement funds. So there was a meeting, I did watch part of that yesterday. You know, there is some clarity and changes about, you know, what the state is doing to help municipalities appropriate, receive these sort of funds. So I'm not going to get into too many details, but feel free to reach out to me or to Isabella and just look on the state's resource page for municipalities. And there are some updates there. And I just want to highlight for Southborough and Westborough, Boylston, you don't fall under this, Carrie, but the prevention work with the mass call 3 group out of Hudson, as a reminder, also has $10,000 available this fiscal year for our 3 communities or any of the Metro West towns, or sorry, the mass call 3 towns. One of the things we're looking at in our shared region with Southborough through our coalition is hosting some trainings that would be coming up that would be available to coalition members. So there's some flexibility, but reach out to Laura and Antonelli and Hudson regarding that information. That is a tight timeline because those funds must be expended by June 30th. And they are anticipating Mass Call 3 giving out another 10,000 next year to their towns.
Sorry, what trainings do you think about holding?
One of the Southborough Youth and Family has been looking into it. One of it, it's with the Montana group. Wait, there's 2 Montana groups that do this, like, what is it? Positive, you know, outlooks framework for, you know, improving public health.
It's focused on social norms. There's one it's the Montana Institute, and then the Montana University also does some other trainings.
Thanks. So I think, Jen, if Northborough, Southborough contribute toward that and Hudson will as well, I think that would be open to all of the coalition towns. And if there was interest, Boylston, I really don't think they would not allow somebody. A lot of these trainings, you know, they have a pretty high capacity, I believe, for that one group. So I think regardless, you guys using your 10,000, I think that's going to be available to you and I'll keep you in the loop. But there's some other ideas for spending and I could share with you, you know, sort of our breakdown table we submitted to Hudson for approval.
Can you send that to me for sure? Because I know that the grant has been used for Westboro yet, so I'd like to submit that.
Okay.
You can join in. Thanks.
Okay.
Yeah, and send it to me too. That would be helpful. And
Okay.
What did the other towns think about the additional opiate settlement with Walgreens and CVS and such.
I just know you need to sign on, so towns, I forget what the exact deadline, I don't know, how long that's going to take. I can speak to Northborough that we've received over 107,000 already. We won't be able to appropriate till town meeting. So we do have a warrant article. But with the new updates that came yesterday on the state's call, some of that was a surprise to me. So I think I have to talk to our accountant and town council and make sure that with these changes, the warrant articles that we've drafted are even still appropriate, needed, or.
Right, we're doing it at fall.
Mhm.
Mhm.
Yeah, so we could try to find that document, Isabella, and circulate that with the follow-up information. Okay. All right, if we'll move on, I'm excited to hand it over to Erin, especially before she leaves in the next few minutes, because she does have to run out the door, but just in time. Can you update us on your Narcan trainings?
Yeah, hi everyone. So Narcan trainings have been going well. Since we started with the first training in December, we've done 16 large group trainings between libraries and local businesses, a couple and some local businesses, and then that has resulted in 231 kits being given out, and there's 2 doses per kit, so it's 462 doses of Narcan that we've distributed to the community. Which is great. And we have 10 trainings set up over March, April, and May across the 4 towns.
So I have not been updated at all about trainings happening. So I was wondering, I think Jim has been wondering too, where Westboro stands.
Making sure I'm still on. Okay. So I actually just came back and I've been in communication with a representative from Westboro, and I have 2 more in Westboro that Jim will be updated on. So I can tell you exactly when those are right now.
So who's the representative that you're speaking with?
Oh, sorry. Can you say that again? Sorry.
No, that's okay. Who's the representative in Westboro that you're speaking with?
Tracy Graham
From
the Westboro Library.
the library. Okay.
Yeah.
So the other thing to update with Erin, they've been doing the programs through the library just because it's a common meeting room for trainings and they're promoting it. But note that our shared staff would be available to do trainings in your office. So in Boylston, their town administrator had requested the nurses to come in and train the town employees. And in Northborough, for example, we held our AED CPR training for employees and we added the Narcan on. So we trained all 60 plus employees. So if it's something Jen and Jim in Westboro, for example, or in Southborough, ladies, where you would like to have staff trained, or private business where you've identified that there's been overdoses, or some other resource. Erin's working with the Junior Women's Club in Northborough, reached out, which is like a civic volunteer group, and she's providing a training to them. So I think we might get limited on the bags. We'll be ordering more of those with the recent approval from the contact tracing allowance. So it really can be, for employees, it could be, like a Rotary Club, or, anybody that wants this training, as long as their nurses are available and they can build it into their schedule, we're happy to provide that. I don't want to speak for you, Erin. You can speak to that, but she's she's really been covering everything from the public through libraries, staff through town offices, private businesses, even, and on nonprofit groups, et cetera.
Yeah, and in Westboro in particular, we had a lot of momentum with a great turnout at the library, and they really wanted to get some more on the calendar right away. But then they were waiting to hear back from other people that they had already reached out to for specific times and dates and stuff. So there was kind of a lag in time. So that's maybe why.
That's great. If you're doing this through email, could you just include Jim on emails or myself, just so we're updated quickly, just because my board has been very interested in this and I know other people have been asking. I have not been able to tell them anything. So
absolutely. And anytime you have any questions, you can always reach out. But I had Jim on there, and then occasionally, would like somebody would respond just to me versus to the 2 of us or things like that. So
and even if you add me as well, that'd be great.
Yeah, absolutely. I can add you on anything.
Thank you.
You're welcome.
And we're looking to do an employee one during Wellness Week, so that's in the works.
And the one thing that does not appear to be limited is the state sending the naloxone, the Narcan. The Isabella works with Erin and doing the required reporting through the state, and the order goes in and the product shows up within like 3-4 days. So I mean, it's great news. Like the state's doing a good job. The one thing you'll hear about on all the opioid settlement calls is they're like, we've got Narcan distribution covered. This program is working, and they really are very responsive. So kudos to the state.
Yeah.
Okay. Excellent. All right. Thank you, Erin.
You're welcome.
We'll jump on other program ideas. We have a few minutes tagged here. Just want to bring up, I've been speaking in Northborough with our librarian, Jen Bruno, and we were debating, trying to do a health literacy project with the libraries. The one thing, helping or making like a 3-page pamphlet, maybe even contracting with a graphic designer to just sort of help us make a pamphlet where we could leave it at the libraries and distribute to people on where to find reputable health information. If you have a recent diagnosis or you have a loved one with a recent diagnosis and you're trying to understand it, just pointing people to reputable sources and not some random blog online. Like, what are the recommended links? Obviously there'll be the call your, PCP and those sort of things for trusted sources of medical information. So I'm going to be working with my librarian to see sort of next steps, but that's something we could do as a group. I know a lot of these librarians work together anyway. The resource wouldn't be, none of these resources are town specific, right? So if that's something you're interested in, let us know.
Yeah, I love that idea. I think it's
Yeah, I
great.
do too. There's also, Jim and I were speaking yesterday, if we could, part of our master plan in Westboro is giving monthly public health education. So if we could do the monthly, whoever puts it out of, like breast cancer is October and this month is
Colon.
MC and colon. Yeah. So if we could do like a flyer or a pamphlet or an informational something to put out to our residents once a month about that subject, that'd be super helpful for me. And I'm sure, I think it'd be good for everybody, but that would be fantastic if we could discuss something like that moving forward.
We did bring that up as a possible APHC, so the Academic Public Health Corps. We met with them and said, this is a great project. We've got a rough calendar. Erin worked on that. Other nurses worked on that. And we're like, okay, here's our calendar. And like exactly your point, Jen, we just want like a monthly, flyer to hang at the library, a social media post to put on our Facebook page. We just want to get in that routine that it's scheduled, it's consistent, they know who it's coming from. And so we didn't get anywhere. It's very cumbersome, that process. They're trying to send us it's more anyway, we're rethinking that. But the good news is the state did tell us that we could pay a graphic designer to help us. I know our staff are great at content and content review, but what we might fall short on is just the time, energy, or interest in making it all look nice and make it look similar and make it look consistent. So I am planning to reach out to the graphic designer that we used in Northborough for our Be Well Northborough guide. Many of you have seen that. She's really great. She's small and she's good at this kind of stuff. I know we've all become Canva masters over the last few months. It's an awesome tool, but it's time consuming. And I think it's more best to focus our energy on content and not maybe on design, and really if we have the funding. So I'll try to get a proposal from Natalie, that graphic designer in particular, to see if she could help us. And then what we could do is probably just do a small working group on that project, right? Like, let's all agree. And then we could say, I think we need to agree, like, what formats do we want? Do we want a poster, and who would print them? Those are the things I think if we come together, we could have posters pre-printed to be hung in all of our towns. And then it would just be like, they're done for the month. Like we could do the whole calendar year and sort of save those. So that would be a project I'd be interested in. I can try to get some quotes from the graphic designer if you guys like that idea.
Yeah, no, I think that's great. We do a little every 3 months. We do an email reach out with a public health topic, but I think this is much better done on a boroughs level.
Okay, awesome.
Yeah, I love it. I'm part of sign me up for part of that group.
Okay, awesome. Any other ideas on other program ideas that anyone wants to touch on? Okay, So seeing none, we will move on to our next agenda item is our DPH intern opportunity. If any of you were to, if you look at the agenda, there's the actual link. I worked with Isabella on this. I know we did solicit some ideas from all of you regarding the DPH intern. We've hosted an intern for the last 2 years. No, at least last year was Ariella Levinson, who did that great work for us on our COVID clinic, our COVID numbers and pediatric vaccines hesitancy and surveys. She did public message, a PS public service announcement through her cable access. I thought she was a great intern. This DPH program, literally, it brings in the cream of the crop. They're paid through DPH. I don't know what the rate is this year, $15, $17. It's good pay. We don't handle any of it. We just throw some projects and ideas at them. So we did submit for, North Boroughs / Greater Boroughs, sort of 3 concept ideas. One was around food insecurity and seeing if we could make a shared calendar or shared resource. So if we were to be able to work with our youth and family or other groups and distribute it, that here are all our food insecurity resources in our communities and where they can go for help. Because many of our pantries and, places where they provide meals are open to more than just the town that you're in, but you might not know of it. So we were looking to, that was one possible project. We could, go a lot further than just that, but around food insecurity was one. The second project, Isabella, was just really for Northborough. We were thinking about some review of local Board of Health regulations. We could get up to 1 to 2 interns. So that in Northborough, we need to step up on a few of our regs. Specifically, we're looking at like our well regulations. Maybe
We want to
even
do
looking
that too.
at our Title V. So, my goal would be picking a regulation or 2 and having them review Greater Boroughs, local regulations, statewide recommended guidelines, and provide drafts to boards of health on regs. And the third project, Isabella, remind me.
It was website design and again, some like health communication. So that's pretty open. And basically how we did it last year is we met with the intern prior to their start date. They told us their interests and we kind of made it match. So they really had an experience that would help them in their college career or master's career. So we're really excited. And I think we'll get the placement in the next 2 months. And then they start in June and end in August.
So these internship opportunities are advertised through the through DPH, through the colleges. These are all master's level. I believe for the most part, they've really moved towards, I think 80% of the candidates are interns are coming from master's level or PhD programs. So we'll keep you in the loop. And we put a range out there because we don't want to not have an intern. So even though, let's say regs was most exciting, to us as a goal for Northborough, it might not be attractive to an applicant. So we tried to put several projects. So hopefully we get a candidate that wants to work in this region. And then based off of that, we'll be reaching back out to all of you and seeing based off the project they choose, if you have interest or would like to be involved and if you think that works for your community. So stay tuned. It's out there. We're posted. And if you know of any interns that may be interested, it's a great opportunity. So that link was in the agenda. The individuals can view that link and push it out. All right, so we are on to now our Greater Boroughs Partnership for Health website. So we've talked about this before. We even had an approved budget for $2,500 to do the work to use our graphic designer to help us create a website. The town of Northborough did purchase a shortened URL, but it's not yet linked. Our IT department has been short-staffed for the last 2 months. So we did purchase gbph.org. It's supposed to be linked to our Greater Boroughs page. We've tried to work within the Civic Plus format that Northborough is upgraded to, and I finally had enough. So we are going to revamp and go back to the idea of going to the graphic designer and really building a space. I think it will be built in Squarespace that way, or another third-party platform. That way it's truly independent and we don't have a big long town URL in advance of it. So stay tuned. The money is there. It's already in our budget for the $2,500. We'll likely be working with our shared staff to get that project off the ground and go to a third-party website. So thanks for your patience. We'll be soliciting feedback, but the website link is purchased. It might be referenced on one of our substance abuse flyers. It's not yet linked, but that request went out. It might be linked to the placeholder Northborough site for now. So we've spent no money, but that project's on its way. Any other questions on website? Okay, so and lastly, approval of the meeting minutes. These were circulated with the agenda last week. So we have two sets of minutes to approve. The meeting of September 14th, 2022, as well as December 14th, 2022. So I guess we'll start with September. I don't know if we can entertain a motion to accept those
I'll
meeting
make a
minutes.
motion to accept the minutes for September 14th, 2022.
And I can second that motion. And then any discussion on those meeting minutes?
No discussion, but I have to abstain because I wasn't at that meeting, so
And I'm-
I don't think.
Yeah, I was just pulling that up. I know we were missing. I know, Jen, that was the meeting, I believe we ended early. Am I making this up, Isabella? I'm pulling it up here now. Yep, that was the meeting, Jen, you had to jump off a little
I
early.
thought it was September. She jumped off early.
Yeah, okay. So,
September.
yes. So if we're doing the motion was for
September.
September?
Yeah,
Okay. And so any other discussion on the September 14th meeting minutes? Okay. So we'll do a roll call vote. So Kristen Black, I approve.
Sarah
Heather
Barrett,
Alger, yes.
abstain.
Heather Alger, approve.
Jen Sullivan abstain.
Oh, you were there for the meeting and then we ended early. So you were actually there. So we
I
need
thought
your
you
vote.
continued after I left.
No, it didn't. We ended it.
Oh, okay, then I.
So if you look at the minutes today, okay, yeah. We were all confused. We were like, can we continue? And then we ended. So it was a little awkward of an ending if you watch that recording available online. But okay, so those meeting minutes are approved. And now the December 14th. Want to entertain
I move
another motion?
to Approve the minutes of December 14th.
I'll second.
Okay, any discussion on those meeting minutes?
The only thing I see is that under present alternate voting member, I know that the chief was present, but he is not a voting member, so he should be moved to present non-voting.
Okay. Thank you, Sarah. That is noted. We'll make that change. And that was at that time on December. Was he not a voting member as of December? I can't remember when that vote was taken.
He was not.
Okay, so we'll move him to non-voting.
Thank you.
Any other changes or discussion? Okay, I want to revise the motion to the, I guess I'll revise that motion, Heather, to as amended.
As amended. I'll second that motion.
Okay. And then we'll do a roll call vote. Kristen Black, aye.
Jen
Heather
Sullivan, aye.
Alger, aye.
Sarah Barrett, aye.
Okay, so it's unanimous. The meeting minutes of December 14th are approved. Lastly, we just have here to confirm our future meeting dates. Again, sticking with quarterly. I do want to add one date if we were going to place one in for the budget review. I'd like to do possibly if we could stick with the Wednesday, it would be the 12th, April 12th. If we need to do a short meeting on the budget, would that work for all of you, an April 12th meeting at 2 p.m. via Zoom? Okay. And then we'll still keep with our quarterly of June 14th, which is good because that's before, at the end of the fiscal year, September 13th, December 13th, March 13th. So that's just sort of where we fall. So please keep those in the calendar. And in
So
mind.
the April 12th at 2, is that what you said?
Yes.
I have another Zoom call right at that time, but as long as you have
A quorum.
a quorum, you should be all
Or
set.
would it work for people if we were to move that to 1, just to try to get everybody? Would that work for?
I can do 1.
Okay.
I think so.
All right. And Jen and Heather, would 1 o'clock
think
work on
so.
you for the 12th for the budget? Just a half hour?
Mhm.
Okay, so let's aim for that. Let me put a placeholder in. All right. So there were our meeting dates. Any other questions in discussion or business to come before the board? All right, entertain a motion to adjourn.
I make a motion to adjourn our meeting.
I'll second.
Thank you. And roll call, Kristen Black. Aye.
Heather Albert, aye.
Sarah Barrett, aye.
And Jen, we just need your roll call and motion to adjourn.
Oh, I did.
Oh, you
I
said
think I did
aye.
at the same
Okay.
time as Heather did.
Sorry if I missed you. All right, we are adjourned. Thank you, everybody. Looks like
Thanks,
we'll be a lot of
everybody.
emails back and forth, additional info. So thanks again.
Thanks, bye-bye.